Over the next 3 episodes, we'll be diving deep into the challenges of obesity and being overweight, which is fast becoming a pandemic affecting millions of the global population. We'll seek to uncover how a collaborative approach combining diet, mental health support, medical intervention, and of course exercise can create a sustainable pathway towards healthier living. And today we'll be focusing on the role that excess weight plays in the development of metabolic diseases. And my guest for this discussion is Dr. Mark Opperman. Welcome, Mark. Good to have you with us.
Thank you, Michael.
Now, Mark, I think it can be blatantly stated that sort of obesity and people being overweight is becoming a pandemic of sort of epic proportions and a huge health crisis of our time. What is sort of going on here? Why is there such a big change that's now so pronounced as we stand?
Michael, if we look at the statistics, it's frightening. In the 1980s to 1990s, about 20% of people had obesity. At the moment, we're sitting at about 46% of obesity. And the frightening thing is that the incidence of obesity and overweight in children under the age of 18 has quadrupled.
My goodness.
Now, weight in itself is a driver of so many metabolic diseases, but also of neurological and psychological issues, orthopedic and bone issues, that it is the world's biggest health emergency at the moment. The driving force, I think, if you look at it, is what has changed from this 1970s up to the late 1990s and then up to now. And that's our lifestyles.
Right.
We are working differently. We are working sedentary. You sit in front of your computer and you work. No one works in factories or on the fields anymore. We relax and play sitting down on screens.
Yeah.
And then, you know what, diets have changed. For affordable food, most of it is incredibly highly processed, and it contains excess salts, excess sugars, excess fats. To feed the masses, to bring cheap food to the table, it's highly processed, and that gives us a problem. So now we get dysregulation of our lipid metabolism, in other words, the cholesterols and the fats, and that leads to insulin resistance and inflammation, and now it starts to snowball.
So Mark, let's go into the metabolic diseases. What are the biggest ones that you're seeing as a result of the obesity epidemic?
So we actually need to understand what metabolic disease is.
Right.
Metabolic disease is a cluster of conditions that leads to mortality or risk for disease.
Right.
So it starts with dysregulation in lipid metabolism as well as insulin resistance. So those two factors are key, and then inflammation that goes with them. Now, this leads to changes in blood pressure and changes in cholesterol levels and changes in weight. So to diagnose metabolic disease, you need 3 of the following 5 criteria. Okay. So the simple one is waist circumference. If male's waist circumference is above 100 centimeters, and for females above 88 centimeters, you have one of the criteria.
Okay.
Blood pressure above 135 over 85, second criteria.
Okay.
Changes in cholesterol works in 2 ways. We have good cholesterol, the HDL cholesterol, and then that drops below 1 for men and below 1.3 for women, which is quite interesting. You have another criteria.
Okay.
Then part of the cholesterol as well is the triglycerides, the fatty oily component of cholesterol. And if that starts climbing above 1.7, it's a positive criteria.
Okay.
And then we look at glucose. If the glucose is above 5.6, you have another criteria. So any 3 of those 5, and you will have metabolic disease. And this is associated with cancers, heart attacks and strokes, diabetes, kidney disease, liver disease.
Okay.
So, it's the leading cause of death. Obesity is the 5th leading cause of death in the world.
And it's interesting because, when you talk about those factors, somebody who is overweight, just by looking at somebody who's overweight, you're going to kind of recognize that they're likely to have a number of those
I
factors.
like that you say that, because there is a condition where you have healthy, obese people that don't have metabolic disease.
Okay.
But I have metabolic disease. If you look at me, you would never say that.
Okay.
But we come from a family where our genetics predispose us to elevated cholesterol levels, a little bit of hypertension, and I'm a type 2 diabetic. So, my insulin as well as my glucose levels are raised. I have metabolic disease. You would never say that. But it doesn't mean that when you have normal weight, that you are healthy.
Right.
And this is what makes screening for this disease so incredibly important, because it's not just the weight, it's the actual underlying cluster of conditions that affect morbidity and mortality. You know what, Michael? One of the problems that we see is that socioeconomics play a really, really big role here. Later in our series, we'll get to the place where you have malnutrition with obesity in one patient, in one community. And that's the problem. Food security is really something that we need to look out for. This has a detrimental role on people's well-being, quality of life, ultimately causing death and disease. And it is something that can actually be addressed with us just identifying that we have this problem, preventing it by having a healthy lifestyle, which includes just moving.
Yeah, absolutely. The weight loss, people are trying to lose weight. There are people out there who are trying really hard to lose weight, but are often really struggling. Why is it that people struggle so much to turn it around?
Michael, simply, weight loss is a chronic disease, like hypertension, like diabetes, like HIV. It's a chronic disease. It requires a multidisciplinary approach. You will not do this on your own.
Okay.
Medical intervention, lifestyle intervention, where we take a look at exercise, sleep intervention, nutritional intervention, and mental health support.
Right.
This is difficult. You can't do it on your own.
Mark, well, I'm really excited for the next couple of discussions because it's a wonderful sort of holistic approach that we have planned. So, but in the meantime, anybody who might want to just get in touch to chat to you about their situation, how can they get hold of you?
You know what, we are based here, the T Clinic is based here in Johannesburg, but we consult with patients all over South Africa and internationally. It's easiest to get us on our number at 010-841393 or any of the social media handles. Our website is www.thetclinic.com.
Wonderful. Mark, well, I look forward to carrying on this
Thank
discussion
you.
with you next week. Stay well.